Dr. Denise Vezu, all the way from London, and the psychiatrist, Dr. Bioku Ayodeji Abbas from Kebbi. Good morning, doctor.
Good morning.
Good morning. Good morning.
Good morning,
and welcome. Interesting topic we have for conversation today. So, Dr. Ojo, maybe we'll leave it to you to take the first shot, and let's get the perspective of Dr. Bioku Ayodeji Abbas on it.
Okay. Good morning, everyone. Yes, thank you very much, and let's get this thing rolling again. I always have to crack a joke, sorry, because the journey is not very easy. So first, one of the first things I want to ask Dr. Abbas, considering, and you know that I will be talking from a perspective of living with cancer, what is the burden and causes of psychological distress that you have identified in patients living with cancer, that you have, or medical profession in Nigeria have?
All right. Good morning, everyone. Thank you very much for having me here. When we talk about psychological distress, it has many components. Anxiety and depression symptoms are, what comprises psychological distress. And we know that cancer is a very serious disease, if I may call it. Some people see it as terminal disease, even though it's not. So the burden is high. Everybody knows that, because of the fact that when you get the news of that, or newly diagnosed as cancer, then there is this anxiety, there is this anger, and people will go through the normal stages of grief, which I'm going to talk about later. So among the causes, you can have emotional causes of distress, physical causes, then the distress associated with psychosocial support, which is very significant. Part of the emotional cause is that what I've mentioned, where people begin to, exercise excessive worry over the news, shock. Some of them will come with anger and all that. But most importantly, the physical causes are actually the main issue. When you look at the stage of having the cancer itself, it depends on the location of the cancer, and then the issue of chemotherapy, where some people will have dry skin, lots of hair, and all sorts, change of physique, looking more older than your age. All those ones are actually associated with psychological distress. However, the emotional distress that I feel is the main thing of this particular presentation is the fact that every cancer patient we ask to, pass through the 5 stages that we all know of grief. Initially, when the cancer is diagnosed, people will be shocked, there will be denial. And I must say that many people will not be able to negotiate through this till the cancer takes them away. Then after the denial, of course, you will be seeing why me, it's not me. I reject it, especially in this part of the world where we believe so much in religion. I reject it in Jesus' name or in Allah's name or whatever name. That is the first stage. And then the second stage of this is that they become angry, the anger comes in, and then they get irritable easily just because of this bad news. Then, thereafter, they start, bargaining. They started bargaining. God, if you can do this, if I can escape this, if I can do this. And then, I must say that it may not follow sequentially the way I'm explaining it. Everybody has the way of, passing through that. However, after the bargaining, then there will be acceptance and this feeling and depression can come in, coming to terms with, this thing is now real. And of course, the acceptance comes in, and then if somebody was able to negotiate or is able to negotiate the grief process to the level of acceptance, it is actually good for the person, because when you accept something, then you need to seek help, and you need help. And unfortunately, in this part of the world, people don't even leave the stage of denial. I have a sister that died of cancer recently because he denied and he did not accept the result of death. Not until when the cancer, metastasized to our spine and eventually died. So psychological distress is a serious issue. Anybody can develop distress while they negotiate through these stages. And it depends on your innate ability to cope with whatever situation that you are in that will make you to negotiate well. However, grief is normal reaction. But when it becomes excessive and then the worry continues, then it is now pathological.
Thank you. I can identify with that very, very clearly. And to be very honest with you, I think all those phases you just outlined are very true to anybody who has gone through this or is going through it at present, which is something that I have to admit. I can't deny I've been through, I think, every single one of them. So, I'll ask you another one. As we have learned, cancer treatment is you guys call it multi-component, and involves a number of specialists. Yes, I agree, from various fields. Is psychologically a really accessible discipline is it really accessible in Nigeria? This particular arm, I'm trying to phrase it properly. It's simply for all of us that have it. This psychological arm of it, is it readily a discipline that supports cancer patients on this journey going forward?
Yes, it's quite unfortunate that psycho-oncology is still at the primitive level in this environment. So many factors are responsible. So to first answer your question straightforward, I would say the mental health aspect of cancer is not taken care of in this part of the world. And it is not anybody's fault. Some factors are responsible, just like I said. There are no, for example, lack of specialists to actually help in this area. Psycho-oncology is actually an evolving, aspect whereby everybody is seeing mental health aspect of cancer as important as cancer itself. So you mentioned multidisciplinary approach to cancer, which is true. It involves cancer treatment to involve psychologists, psychiatrists, oncologists, surgeons, and some other people that will be involved depending on the type of cancer that the person is having. So, and it has to be from the infection, because if you don't screen people with cancer for mental illness early, it will definitely affect the patient's outcome. Many studies have indicated that when you screen for psychological distress early enough and you institute intervention early, then you are expected to have better treatment outcome. And one of the common instruments they are using in abroad now is National Comprehensive Cancer Network instrument, distress thermometer. Of course, we did a little study in our environment, and to our amazement, many people, including healthcare workers, they don't know about distress thermometer to even measure the distress in cancer patients. So, if healthcare workers don't really know the instrument, how do they measure it? I must say that it is still very, primitive, just like I said. But because of the increase in the cancer diagnosis due to advancement in instruments, and because of the fact that the awareness of treatment of cancer is getting broader and broader every day, so we begin to see more diagnosis of cancer, and then people start looking inward to see, okay, now that these cases are increasing, then how can we come together and have a holistic approach to the treatment of cancer? And in our center, we have started the psycho-oncology unit, and we are going to use our instrument that we are validating, which is the same instrument that I mentioned earlier, to start screening cancer people as early as possible for psychological distress so that we can channel it appropriately. And unfortunately, I must tell you that it's only two of us in this state that are psychiatrists, no psychologists, no social work. So, apart from the fact that we have to treat the other patients that are mentally sick ab initio, then going fully into training people with cancer will be difficult. So you need like psychiatric nurses, psychologists and social workers to be able to do all this. So these are challenges, and hopefully indebted.
Thank you very much. But I'm listening to you, and I'm hearing the need for the team to be very equipped, because from my experience, and I would always reverse back to my own personal experience, we have to be very factual. Everything you've said, I have been through it, and I still live through it. So if you say it's not accessible, that is a very big concern, especially when you talk about the mental health, because, okay, we're getting to the Christmas period now, and I'm thinking to myself, what am I going to do? Are you going to be sick? What happened? Your friends, your family, I'm going to hide. I'm not going to hide. It's a lot of pressure on a cancer patient to have to deal with all of this and understand how they're going forward. But okay, the diagnosis, wow, it's interesting. I hope that the systems we have will support us as we go along, because it's very hard. The diagnosis, let's look at the diagnosis, and let's look at cancer and how it affects people. So we accept that it's very distressing to everybody. I think you would accept that, because one of the first things we do is go into denial, and then we go into shutdown mode, then we go into, so everything you said, we do go through it. I can guarantee you that. So what is, in your own professional view, are there any cancer patients in Nigeria who can cope in the course of their cancer journey? What's in your own professional opinion? As some of the patients can
opinion about cancer, how they cope, or the coping mechanism. It is difficult to generalize, the coping mechanism that a lot of people use, because it depends on so many things: your background, your financial capacity, your social support, and then accessibility, just like you have mentioned, to healthcare facilities, with shaping how you are going to cope with the disease. But earlier in the stage, just like I've mentioned, when the news is just fresh, of course, many people resort into using immature coping mechanisms. And which denial is one of the immature coping mechanisms. Some people cry, and people isolate themselves. Those are immature. But however, if such patients started getting help and started accepting and all that, then they may switch to mature, mechanisms, whereby they accept, and then there is what we call problem focusing strategy, whereby people will know this is the problem and they want to solve it. So we have to individualize it. Then the severity of the cancer, the diagnosis, the location, and all those things. And then majorly and most importantly, the financial and family and other support will determine how an individual will cope with cancer.
Okay. I want to reverse back on this, because the coping mechanism that people go through varies, and is predominantly around serious denial or faith. Now, when you look at it from that perspective, because I was doing some study on currently on what's going on, and you find that Black ethnic minority people globally are the ones that are presenting late. And I think we're presenting late because we are in this denial phase. So no matter how we want to make this simple, it is actually not it's actually a very big thing for people going through the cancer journey. And if I should recall, when I was first diagnosed, I first looked at them and I thought, wow, cancer, it's the C word. And C word means death. No matter how you want to make it look nice, that's what it means. That's actually fundamentally why people see that way. It's not necessarily death, but because we already have that programmed in our mindsets, we come from that place of saying we shut down. And that, I think, is human nature. It's not out of anything other than that. So from your view, I'm coming back to this one. This is very big.
Yeah, absolutely. Yeah, absolutely. You are right. Just like I told you that somebody that we just lost with breast cancer died at the stage of denial. It is common in this environment because, we are so much religious. This is something actually good. And I must say that religion could be positive and negative. Some studies have implicated that if you are faithful, you may have, good treatment outcome and quality of life. However, if you are in denial and then you are not doing what you are supposed to do at a particular point in time, then you carry on and mix it with the faith, and then you begin to waste time. And instead of you to seek appropriate help, you definitely such people will have to be either in church or in mosque or alternative therapy stuff, which happens to this particular person I'm talking about, and before you know it, the cancer has gone far from spine to the brain, everywhere, and then you see them for this presentation. It's quite unfortunate that at least average Nigeria will stay in that denial till it's getting late. And this is what we need to now start to do. We must be able to convince the, religious, faith-based organizations and all those things to actually let them know that while they are praying and having, psychosocial support for the patient, they should also encourage such patients to present early. Because some of these cancers, if you present early and you remove whatever the tumor, and then you get your chemo, you are likely going to survive it. I know some people that have, had their breast cut off, and then for like 20 years now, he's still alive and doing relatively well because he presented early and then the intervention was early enough.
Okay, let me ask you one, because I'm also being very mindful of time. The mental health issues that have arisen from things like HIV has been associated, is always been associated, or has been, for that particular illness, stigmatization. And we recognize that. However, cancer also seems to be, well, for me, I would say cancer has stigmatization that comes with it. And I think now research is accepting that cancer is stigmatization and cancer are linked together. So from that perspective, what are some of the problems you can curb with this problem of cancer and stigmatization?
Well, it is very clear that any disease that
please come in like this so I can look at you.
We suffer, early treatment, because some people will not want to present themselves as having such disease, and they continue to hide themselves because of the stigma. So cancer is also having its own stigma, but however, it's a way for now, from my own experience and the little advocacy that we are doing in our own end, people tend to accept cancer more than other mental illness, which they see attribute to spiritual attack, and maybe it can run in the family. So they don't want to marry anybody with mental illness and all that. The same thing is happening in cancer, but the level of stigma associated with cancer diagnosis is not as high as compared to other major psychological problems or psychiatric problems that we have. If we can do more, people tend to accept and sympathize with cancer. Even in the hospital, government or some federal hospitals like ours, some of the workers that came down with cancer were supported, and taken to some other hospitals to take care of. But in the same environment, if you break down psychologically, maybe you become schizophrenic, you may not have that luxury of difficulty. So I would say that the stigma is still there for those who don't know about it. For those in the rural environment who think cancer is transmissible, then the stigma is high. But in other climes where awareness is so, high, and people feel that, okay, they've been hearing on radio, on TV, how cancer is not transmitted. If we can do that for mental illness, including those ones that affect cancer patients, actually, then we will be able to, move ahead.
Thank you very, very much. I just want to ask you give us three tips, three things we should do going into the festive season. Going into the festive season for cancer survivors, cancer patients, just give us 3 tips that we need to get right to ensure we have the right, say, mental health going forward.
Yes, what we need to do is that we need to support the people with cancer. We need to empathize with them. We don't need to sympathize. We need to empathize. We need to put ourselves in their shoes. And then we need to share our love with them and support whatever things that they are going through.
I would want to say a very big thank you to you on this one, because you've actually ended this fantastically for us today. To all those who are viewing, we will be bringing on cancer survivors in the next 2 weeks to come and actually talk about their journey and how they celebrate the festive season going forward. So I just want to say a very big thank you to you, Dr. Bioku, for this fantastic time that you have been able to share the cancer experience. To AIT, thank you for the opportunity to continue to create this awareness that is driving the world at present in this time. So thank you.
All right, Dr. Denise Ejo, thank you so much, and Dr. Bioku Ayodeji Abbas, who joined us from Kebbi. Have a wonderful day, guys.